I think it's always an honor to, share stories with other people. So today I think I would like to start with a story of one of my very first patients. And please comment if you have trouble hearing me. But I think before I started my third year of medical school, I thought that, I was working on climate change really for the future of my future patients, not current patients. And I think that really changed quickly when I entered. So much so that I think even just on the very first week of rotations, I was assigned to a young woman who sort of changed my view on a lot of things. We can say her name is Janine. It's just a fake name, but she was admitted to the hospital that I was rotating at for a flare up of something called multiple sclerosis. And so when triggered, her own immune system would attack her brain and her spinal cord. This would leave her at times, unable to walk or see. And when I scoured through her medical charts, I noticed one particular thing, and that was that her flare-ups were triggered by heat. And so when I went to go chat with her, I, parsed out a few questions. I was very relieved to hear that she had an AC unit. That was really my main concern. But I also learned that she recently lost her job due to the pandemic. And she was also a few months behind on her electricity bills. And this was July of this year in Rhode Island, and we were in the middle of a pretty bad heat wave. My weather app reported, 98, 99s for the next few days, and I knew she would be discharged into a heat wave. But I also knew that in Rhode Island, we have this, we're notorious for electricity companies shutting off people's ACs when they're behind on payments. And this was particularly concerning because at that time, actually our tiny state of Rhode Island is the fastest warming state in the continental US. And already every year we have 10 days out of the year that is a heat wave. And because of climate change, there are estimates that in 30 years, 40 days out of the year will become a heat wave. And that's quadruple. That's not okay. That's nearly 10% of our year. And so, when heat waves happen, people, especially like outdoor laborers, elderly folks, or individuals on certain medications, are more susceptible to heat strokes and organ damage. And even for people like me, I live next to a busy highway. And when heat and sunlight mix with car emissions on busy highways, the ground level ozone triggers asthma attacks for me and for many kids living nearby. But for Janine, though, more specifically, heat waves means more flare-ups for her, and that causes debilitating and expensive hospital visits that could threaten a lot of things, including her ability to find a job and support her daughter. And so, this was sort of the mess that was flowing through my head as I was preparing my oral presentation to my attending. I drafted up this glorious plan. I was going to put her on medications to protect her from her own immune system, IV steroids. But I knew that we had to protect her from the heat. So I proposed a couple things. In medicine, we say that there are Band-Aids, right? Quick fixes. I was like, we could just print out a medical protective status form. It prevents utility companies from shutting off people's ACs in retaliation for late payments, and a doctor's signature could actually do that. I also thought of something called like a bridge therapy, something that could buy her time. And I thought of, we should order a social work consult to identify programs that would allow her to continue access to electricity like HEAP, or even just like health insurance or, access to a living wage. And, these are all things that we need to protect her from climate change and increasing number of heat waves. But, when I propose this to my attending and my interns and my residents, they usually don't look at me, but this time they like swiveled around to look at me incredibly confused and lost, as if like, you're not a social worker. This is not your job. Why is your assessment and plan so long? And I really wish at that time I could say that I blurted out something very eloquent about advocating for patients, but I didn't. I went home and I thought about what would happen if my interns or my attendings thought I was incompetent or too aggressive. And I mulled it over for a long time, really, until I mustered enough courage to do the right thing for the patient, regardless of how much it looked on my end. So I printed out the form and I put in the social work consult myself and just asked the intern to approve it. And this encounter really was a pivotal day for me in terms of like my own reflections on climate change and health. And I wish I could say, if we just trained every physician across the country, across the world to know every band-aid solution, every bridge therapy, every state and local service we could throw at patients to protect them from climate change, we'd be good. We just need to educate. We just need to educate, yeah. Um, but that's really not the case. And I really start to think about what counts as preventative medicine when it comes to climate change. And so, I was talking about earlier, 10% of the year in Rhode Island will be in a heat wave in 30 years. And already, like, I am seeing patients in clinic with diabetes, for example, who can't reach their treatment goals in the summer when it's too hot for them to exercise outside. And I'm seeing patients struggle with sinus headaches like never before because climate change is lengthening the ragweed pollen season, especially on the East Coast. Um, in Rhode Island, we have studies that are showing that pregnant individuals go into preterm labor more often when it's hot. And, in light of the increasing number of hurricanes here, when I went on street outreach a couple weeks back, I learned that people living on the streets who are houseless, like now, are they don't have options, as many options as they used to find shelter in the middle of a hurricane because of COVID precautions. And that's horrifying to be outside in the middle of hurricanes and increasing numbers of hurricanes. And, I know that all of you in Northern California understand more than I do how increasing wildfires are devastating the health of your communities. Um, and so as someone applying into residency next year, I'm hopeful that I can return to my home state of California, where I grew up. But I'm also wary that, no matter where I go, I will see different effects of climate on health, whether that's air pollution in Nevada, whether it's West Nile virus increasing in Texas or harmful algae blooms in Florida. We're going to need more than Band-Aids. Doctors need to be practicing preventative medicine. People in healthcare and public health need to start thinking about this. And I think this year in particular, and what this panel is about, is that this is where everyone here comes in. We could do this by voting. We can elect not only a president and all the cabinet members that they will appoint, but even forgetting this treacherous presidential election, we have future city council members, state reps, and senators that we can elect, leaders who can write and vote in policies that will, not only get us to zero emissions, but also policies that ensure things like affordable housing, secure electricity, economic security, and healthcare for all. These are all the things that will protect the health of our communities and make us more resilient to climate change. And so, I know the national scene looks devastating right now, but I'll leave you all with a little bit of hope. In our tiny state of Rhode Island, in our state primaries, we actually elected a slate of 13 new progressive candidates. And in the general election in November, if we can just elect 3 more representative state reps backed by Sunrise, we could easily pass a Green New Deal for Rhode Island. And not only that, we could pass things like a $15 minimum wage, single-payer healthcare, and reproductive access bills. And, that's what really gives me hope, is that our local government and state governments can sweep in a new future for us, and we have the power to vote for them and smart policies. So, sorry, that was sort of my long-winded spiel, but this panel gives me hope. And I'm convinced that, to prevent climate change from harming our communities, we have to take bold action against climate change. And we are lucky that every 2 to 4 years, we have the power to do that with a vote. And, especially this year.